So you sit down in the chair, right? The bright light is, shining right in your eyes. And the dentist looks at you and says, you need a root canal.
Oh, yeah. That's a phrase that instantly makes your jaw clench.
Exactly. The immediate reaction for, well, pretty much all of us is just pure dread.
Right, because we've been culturally conditioned to treat that phrase as like the ultimate bad news. But the clinical reality, if we actually look at the physical mechanics of what's happening in your mouth, is completely the opposite.
Okay, so wait. The root canal isn't the bad news.
No, not at all. I mean, the infection is the bad news. The root canal is, it's essentially the rescue mission.
A rescue mission. I like that.
Hmm.
So to understand exactly how that rescue mission works, we are pulling from a really specialized stack of sources for today's deep dive.
We've got some great material today.
Yeah, we're looking at educational pieces from the American Association of Endodontists, clinical guidelines from Health Direct over in Australia, and also some really technical scripts from Vinnova Dental. They serve the Wangaratta area.
Which is fantastic data to have.
It is.
Yeah.
But honestly, accessing some of this Australian dental data felt like, I don't know, breaking into a vault or something. The site was locked behind this incredibly strict Cloudflare security verification.
Oh, really?
Yeah, complete with Array ID it was, like A0122910A373, and mandatory JavaScript checks, cookies, everything, just to prove I wasn't some, malicious bot trying to scrape their dental secrets.
That's a highly accurate parallel to the biological system we're analyzing today.
Wait, my internet security struggles relate to teeth.
They really do. Your tooth's enamel is basically a biological Cloudflare firewall. It's incredibly hard, and it's explicitly designed to keep malicious bacterial intruders out of the highly sensitive protected environment deep inside your tooth.
Oh, that makes total sense. So the enamel is the firewall.
Exactly. And when a cavity decays that enamel, or say a physical impact tracks it, the firewall fails. The bacteria get in and compromise the entire system.
Right, they bypass the security.
Yeah. So a root canal isn't the firewall failing. It's the specialized IT security team coming in to physically wipe the server, neutralize the malware, and just restore the system after a critical breach.
Wow. Okay, so the firewall has failed. The malicious bacteria have breached the enamel. To understand why this creates such an intense physical reaction for you, the patient, we kind of have to look at the battlefield itself, right?
And it's a very unique microscopic environment.
Yeah, because inside that hard outer shell of the tooth, extending from the crown all the way down into the roots, there are these tiny hollow spaces. And depending on the tooth, you might have up to 4 of these root canals.
And they are not empty. That's the key. They house the dental pulp, which is this highly sensitive matrix of nerves, blood vessels, and connective tissue.
Which is what kept the tooth alive when it was growing, right?
Yes, exactly. It's the life support system that helped the tooth grow in the first place. But the primary issue arises from the actual architectural structure of the tooth. That sensitive pulp is entirely encased in rigid dentin and enamel.
Okay, so it's trapped in a hard shell.
Right. So when bacteria invade that space and infect the pulp, your immune system responds with inflammation, which isn't normal.
But unlike a swollen ankle where the skin and the muscle can just stretch out, the tooth cannot expand. The inflammation has absolutely nowhere to go.
Which creates immense trapped hydrostatic pressure.
Ouch. That sounds awful.
It is. That pressure literally crushes the nerve endings against the rigid internal walls of the tooth. That right there is the mechanical reason behind that excruciating, throbbing toothache that keeps you awake at 2 a.m.
And is that also why you get that crazy sensitivity to hot and cold?
Yes, exactly. You might feel extreme sensitivity to hot and cold that lingers for minutes after the stimulus is gone, because the nerves are completely hypersensitized by the physical pressure inside that chamber.
Wow. And the clinical guidelines from Health Direct also mention some visible warning signs, like the tooth might actually physically darken in color as the tissue inside begins to die, or you might see a pimple-like bump form on the gums right near the tooth.
Yeah, that bump is called an abscess tract.
A tract, like a tunnel.
Basically, yeah. The pressure inside the tooth becomes so great that the resulting pus, which, by the way, is a collection of dead white blood cells, bacteria, and tissue debris, it has to find an escape route.
Oh, that is so gross, but fascinating.
It utilizes enzymes to actively burrow a tunnel through your surrounding jawbone, eventually erupting through the gum tissue just to relieve the pressure.
Okay, let's unpack this, because if that is the alarm system functioning normally, let's look at the scenarios where it fails.
Yeah.
The AAE highlights a really common myth. People assume that if a tooth doesn't hurt, if there's no pain, then there is zero need for this intensive rescue mission.
Right. They think if it doesn't hurt, I'm fine.
Exactly. Like, if the pressure isn't crushing the nerve, aren't we in the clear?
It's a very logical assumption,
Right.
but clinically, it is extremely dangerous.
Why is that?
Well, sometimes the bacterial infection is so aggressive or it's been present for so long that the nerve tissue inside the pulp becomes entirely necrotic.
Meaning it's dead.
It is completely dead. So the alarm system is totally offline. A dead nerve cannot send pain signals to the brain, which leads to this really false sense of security.
Hold on, wait. If the nerve is completely dead and the blood vessels are destroyed, how are the bacteria even surviving in there? What are they eating if the tissue is necrotic?
They feed on the necrotic tissue itself.
Oh, wow.
Yeah. The decaying proteins and cellular debris from the dead pulp just become an all-you-can-eat buffet for the bacteria. They multiply inside the hollow chamber, and because the blood supply is cut off, your body's immune system literally cannot reach them.
Because the white blood cells use the bloodstream to travel.
Exactly. The white blood cells physically cannot travel inside the dead tooth to fight the infection.
That perfectly explains why you can't just take a round of antibiotics to clear this up. I always wondered why a dental infection required, physical surgery instead of just a pill.
Right, because antibiotics travel through your bloodstream. If the blood vessels inside the root canal are dead or dying, the drug just cannot be delivered to the site of the infection.
So the bacteria are basically barricaded inside a biological bunker.
That's a great way to put it. They are completely shielded from both your immune system and any systemic antibiotics. The only way to stop them is to physically breach the fortress and clean it out.
Okay, well, if the infection is this heavily entrenched, the procedure to remove it sounds inherently aggressive. And that brings us to the reputation of the root canal itself. The myths surrounding this treatment are just deeply ingrained in our culture, keeping people away from the dentist's chair until the structural damage to their jaw is catastrophic.
It's really unfortunate.
It is. And the first major hurdle, myth number 1, is the anticipation of agonizing pain.
Right. And here is where we really have to separate the disease from the cure. The pain people associate with a root canal is almost entirely the pain of the infection leading up to the treatment.
So the procedure itself isn't the painful part.
Not anymore now. Modern endodontics utilizes highly targeted local anesthetics that numb not just the tooth, but the entire surrounding nerve pathways. The procedure itself feels mechanically similar to getting a standard, albeit slightly longer, cavity filled.
Okay, that's a huge relief.
Yeah, the procedure is the immediate off switch for the pain. It's not the cause of it.
Right. And then there is also a fundamental misunderstanding of what is actually being removed. This is myth number 4. The name root canal makes people think the physical roots of the tooth are being dug out of the jawbone.
I hear that all the time. But no, the roots remain completely intact and anchored tightly in the bone.
So what are they actually taking out?
Well, the term root canal refers to the hollow anatomical space inside the root, not the root itself. Only the microscopic, infected pulp from within that hollow space is extracted. The structural foundation of your tooth stays right where it is.
Okay, that makes sense. Then we arrive at myth number 2, which is maybe the most persistent internet rumor. The claim that leaving a quote-unquote dead tooth in your mouth causes it to leak toxins into your bloodstream, leading to systemic illnesses anywhere else in your body, or even cancer. I mean, where does this concept even originate?
It stems from a really flawed concept called focal infection theory. It was championed by a single researcher named Weston Price way back in the 1920s.
1920s?
Yes. He claimed that bacteria trapped in root canals cause diseases elsewhere in the body. However, his research methodology lacked control groups, his testing environments weren't even sterile.
Oh, wow.
Yeah, and the entire theory was comprehensively debunked by modern medical science by the 1950s. Yet, it somehow survives on internet message boards today.
That is baffling. Believing century-old dental research is like refusing to use a smartphone, because a telegraph operator in 1920 said electricity is spooky. It makes no sense. So what does the actual clinical data show regarding our overall health and endodontic treatment?
The modern data completely flips that century-old narrative on its head. There was a landmark 2013 study published in JAMA Otolaryngology Head and Neck Surgery. They examined patients who had undergone multiple endodontic treatments.
And what do they find?
Well, rather than finding an increased risk of disease, the researchers found that patients with multiple root canals actually had a 45% reduced risk of head and neck cancer.
Wait, really? A 45% reduction is a massive statistical shift. Is there, like, a known biological mechanism for why saving the tooth correlates with a drop in cancer risk?
The exact causal mechanism is complex, but leading researchers hypothesize it relates to immune system vigilance.
Immune system vigilance, what does that mean?
So, the controlled, localized immune response triggered by the dental treatment might actually keep the body's broader immune surveillance highly active. It's like it keeps the immune system awake, helping it identify and clear out malignant cells in the head and neck region before they can form tumors.
That is incredible.
Right. At the very least, it definitively proves that root canals do not cause cancer.
Okay, so with the myths completely cleared out, let's look at the actual engineering of this rescue mission.
Yeah.
Because the Health Direct guidelines lay out the procedure, and it is honestly a marvel of microscopic precision.
It really is an impressive procedure.
It starts with specialized X-rays or 3D imaging to map the internal geography of the tooth, right?
Mm-hmm.
The endodontist needs to see the exact curvature and depth of the canals, which can sometimes split into these complex microscopic webs.
Yes, they have to map everything before they go in.
And once the internal space is mapped and the area is completely anesthetized, the very first physical step is placing a rubber dam over the tooth.
Now, this is a critical step that patients often overlook or find annoying. A rubber dam is a thin sheet of latex or non-latex material that literally stretches over the single tooth being treated, completely isolating it from the rest of the mouth.
Which is so necessary because the human mouth is absolutely teeming with bacteria. A single drop of saliva contains millions of microbes. If the ultimate goal is to sterilize the inside of the tooth, allowing saliva to wash over the open crown would be like doing open heart surgery in a swamp.
That's a very vivid analogy, but it's totally accurate. The dam creates an absolute sterile surgical field. It keeps the operative site bone dry and prevents any ambient oral bacteria from recontaminating the exposed canals while the dentist works.
And it probably protects you from the chemicals they use, right?
Yes, it protects the patient's airway and throat from the potent disinfecting solutions. Once it's isolated, a small access hole is drilled through the top of the crown to reach the pulp chamber.
And this is where the sheer scale of the operation becomes incredibly impressive. The dentist uses these tiny specialized instruments called files to physically scrape out the necrotic pulp and all those barricaded bacteria. We were talking about navigating curved, hollow tubes that are sometimes thinner than a human hair.
It's wild. Navigating that space requires immense tactile feedback and highly specialized metallurgy. These endodontic files are typically made from nickel-titanium alloys.
Nickel-titanium. Why that specifically?
Because this specific metal possesses shape memory. This allows the files to bend and flex through the natural twisting curves of the root without snapping.
Oh, that is cool.
Yeah, and the dentist progressively uses slightly wider files to clean and perfectly shape the internal walls of the canal into these smooth cones.
Right, and as they shape the canal, they continually flush it with antimicrobial solutions. I think the source mentions sodium hypochlorite to dissolve any remaining organic tissue and chemically obliterate the bacteria hiding in the microscopic porous tubules of the dentin.
Exactly. And once the canals are entirely hollowed out, shaped, and completely sterilized, they must be permanently sealed. Leaving them empty would just invite new bacteria to set up a new fortress.
Right, nature abhors a vacuum.
Exactly. So they fill the void with a biocompatible material called gutta percha, which is actually a rubber-like substance derived from trees.
Wait, why does the filling material have to be biocompatible? Like, if the nerve is completely dead, does the body still care what is inside the tooth?
It does, because the tooth itself is physically anchored in the living jawbone. The tip of the root, which is called the apex, is open to the surrounding bone tissue.
Oh, I see.
Right. So if a reactive or toxic material was placed inside the canal, it would trigger an aggressive immune response at the root tip, leading to severe inflammation and bone loss. Gutta percha is biologically inert. The body's immune system simply ignores it, allowing the bone at the root tip to heal seamlessly.
That is brilliant. Okay, so the gutta percha is cemented into place, completely sealing the canal. Finally, because a tooth without an internal blood supply can become brittle over time and fracture under the massive pressure of human chewing, the standard of care is to place a custom-fit dental crown over the top.
Yes, always protect the tooth afterward.
It acts like a protective helmet, basically, binding the remaining natural tooth structure together and restoring your normal bite force. Oh, and here's a pro tip from the sources. If you are heading in for this procedure, keep in mind that your jaw and lips will be profoundly numb for hours afterward. Eating a solid meal before you sit in the chair is highly recommended so you don't accidentally chew up your own cheek trying to eat lunch while numb.
That is a highly practical tip. It saves a lot of unnecessary post-appointment pain.
Absolutely. So the clinical precision of the procedure is undeniable. But human nature dictates that if a medical procedure takes multiple visits, costs money, and involves microscopic metal files inside your head, people will look for an exit ramp.
Of course I will.
What happens if you simply refuse the treatment? We know the bacteria are barricaded. How does the end game play out if it's left entirely untreated?
Well, it rapidly progresses from a localized tooth issue to a systemic bone and tissue issue. As the barricaded bacteria multiply, their metabolic waste and the ongoing immune response create a severe abscess at the tip of the root. This chronic inflammation produces enzymes that actively resorb or eat away the surrounding jawbone.
The structural bone of your jaw literally dissolves to make room for the expanding pocket of infection.
Yes, it just dissolves. Eventually, the structural support for the tooth is completely destroyed. The tooth becomes severely loose and either falls out or must be surgically extracted.
Yikes.
And it gets worse. Furthermore, the infection can spread into the fascial spaces of the neck or head, which can rapidly become a life-threatening medical emergency. Doing nothing is merely choosing a much more painful, destructive path to ultimately losing the tooth anyway.
Okay, well that leads directly to the next alternative.
Yeah.
Preemptive extraction. Why not just skip the microscopic cleaning and pull the infected tooth immediately? It seems like a faster, cheaper way to neutralize the threat.
Pulling the tooth certainly removes the immediate infection, but it introduces a massive cascade of biomechanical failures in your mouth. Your teeth operate as an integrated, tension-based system. They mutually support each other. When you remove a tooth, you leave a void. The surrounding teeth will naturally drift and tilt into that empty space, searching for physical contact.
Right, and that shifting completely ruins your bite alignment, leading to chronic jaw pain and accelerated wear on the remaining teeth. To prevent that collapse, you have to replace the extracted tooth with a bridge or an implant.
And both of those replacement options have significant physical drawbacks. Let's look at a traditional bridge. It requires the dentist to permanently grind down the healthy virgin enamel of the adjacent teeth to serve as anchor points. You are sacrificing two perfectly healthy teeth just to replace one dead one.
That seems like a bad trade.
Yeah.
And while titanium implants are fantastic technology, they involve surgically drilling a metal post into your jawbone, waiting months for the bone to fuse to it, and then placing a synthetic crown.
Exactly.
It takes far more time, carries a much higher financial cost, and it lacks the deep biological integration of a natural tooth. A natural tooth has a periodontal ligament, a microscopic shock absorber that allows the tooth to flex lightly under heavy chewing pressure. An implant is rigidly fused to the bone, which completely alters how force is distributed throughout your jaw.
Which is exactly why preserving the natural tooth is always the gold standard in dentistry.
Right. But it brings us to the complications of the root canal itself, because the Health Direct guidelines mention that while the success rate is incredibly high, it isn't perfect. Like a crown can leak over time, allowing new bacteria to penetrate.
Sure, that can happen.
But the complication that stands out the most is the potential for an instrument fracture. Here's where it gets really interesting. A piece of that hair-thin nickel titanium file can actually snap off and get permanently stuck deep inside the curved root canal.
Yes, it happens. And it sounds alarming to a patient, a piece of metal permanently trapped inside your face. But we have to look at the biological reality of that specific event. These files are highly sterilized before use. If a tiny segment separates and becomes lodged in the microscopic apex of the root, it usually does not compromise the treatment.
But why wouldn't the body reject it? Like a wood splinter in your finger causes a massive painful infection. Why doesn't a piece of metal in your tooth do the same thing?
Because of where the metal is trapped and how it is subsequently sealed. A splinter is covered in external bacteria and embedded in highly vascular living tissue.
Ah, I see the difference.
Right. The broken endodontic file is completely sterile, and it is lodged inside a biologically inert space that is subsequently filled with gutta percha and completely sealed off from the rest of the body. It physically cannot interact with the immune system. Endodontists can often bypass the broken piece to finish cleaning the canal, or they simply incorporate the sterile fragment into the final filling. The presence of the fragment rarely impacts the long-term survival of the tooth.
Wow. When you lay out the mechanics, the biology, and the harsh reality of the alternatives, the narrative completely shifts. A root canal is not a punishment for eating too much sugar. It is an intricate, highly successful medical intervention that rescues your natural biology from a catastrophic breach. It stops bone destruction, cures severe pain, and allows you to keep your native shock-absorbing bite structure intact for a lifetime.
I think the overarching consensus across all these clinical sources is the prioritization of preservation. We live in a modern era where we are highly conditioned to treat things as disposable.
Yeah, that's so true.
When something breaks, our first instinct is often to just throw it away and buy a fast synthetic replacement. But human biology doesn't work that way. Nothing artificial can ever truly replicate the complex, integrated form and function of what naturally belongs there. It makes you deeply consider what else in our lives, whether it's our physical health, our attention spans, or our personal relationships, we might be abandoning or extracting too early just because the repair process seems tedious. Sometimes the most valuable and lasting path isn't extraction and a replacement, but doing the meticulous, necessary work of clearing out the decay and saving what is naturally ours.